Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverdi.
And I'm Montel Williams.
Today, we're talking about diseases that affect the brain, glioblastoma and schizophrenia.
The Balancing Act starts right now. Glioblastoma multiforme, or GBM, is a rare brain tumor. It can be difficult to treat and has a poor prognosis.
Today, one woman's journey from her shocking diagnosis to her determination to survive.
Let's go behind the mystery of glioblastoma multiforme.
I would describe my life in my early 30s as work hard, play hard, nap hard. I practiced law in New Hampshire for a few years, and then I decided to move to Washington, D.C., where my life became pretty hectic. So a few years after moving to D.C., I started to notice that I was getting increasingly severe headaches. When I'd stand up, I'd feel like I needed to faint. I had pressure behind my right eye, and I continued to work like I always had.
Janine went to 4 doctors to figure out what was wrong with her, but had no success. Unable to do her job to its fullest, she resigned and moved to Texas to be with her family.
The final thing I had to do before my move was a final doctor's appointment. When I pulled up to the valet parking stand for that appointment, I suffered a seizure, and that's what led to me getting diagnosed.
The Balancing Act met with Dr. Soraya Jayapalan, a neuro-oncologist, to learn more.
The glioblastoma multiforme is a type of tumor that occurs in the brain. Clinically, they are divided into 4 grades. GBM is grade 4, and it is the most aggressive. They infiltrate then throughout the brain, and they grow. Treating GBMs is a challenging task, not only because of the location of the tumor, but because of its complexity.
Common symptoms of GBM depend on the location of the tumor and may include headaches, impaired coordination, dizziness, blurred vision, and frequent fainting.
If you have neurological symptoms and your physician suspects you of having a tumor, the neurological exam includes looking at everything. They'll do imaging, which usually initially is a CAT scan of the head. If they see a mass, they will do further imaging of a brain MRI in order to confirm the diagnosis.
After they ran a CAT scan, they let my dad and I know that they suspected that I had a brain tumor. And at that point, I felt the need to call my mother and let her know. And I didn't want to hear her reaction because I was feeling guilty about, having to put my family through this already.
Immediately, my world fell apart. I couldn't hardly process it in my mind, what she was saying to me. And I was devastated and I was in shock. It was the most terrifying phone call I ever received in my life.
I was admitted into the hospital, and I underwent an 8-hour surgery to remove the tumor. At the follow-up appointment with my oncologist, I had my whole family with me. We got the diagnosis of a grade 4 glioblastoma, but I could tell with my whole family and what they were saying to me that every single one of them was dedicated to helping me as much as possible.
So the current standard of treatment for newly diagnosed GBM patients, so the surgeon will analyze the MRI and make a decision whether they could do a biopsy or they can do maximal safe resection. Then the patient receives 6 weeks of radiation combined with an oral chemotherapy called temozolomide, and then a month later we start giving them maintenance chemotherapy with temozolomide. Even though at times, the surgeon, with his maximal safe resection, can remove everything that we can see on the MRI. The disease comes back. We can't get rid of every single little cell.
Novocure, a global oncology company, is working to extend survival in some of the most aggressive forms of cancer by developing and commercializing its innovative therapy tumor-treating fields. Tumor-treating fields interfere with glioblastoma tumor cell division. This interference slows or stops glioblastoma cells from dividing and may also destroy some of them. Optune is a wearable, portable, FDA-approved device indicated to treat glioblastoma multiforme in adult patients 22 years of age or older. If you have newly diagnosed GBM, Optune is used together with chemotherapy called temozolomide after surgery to remove as much of the tumor as possible. If you have GBM that has come back, Optune is used after receiving chemotherapy or alone as an alternative to standard medical therapy if surgery and radiation did not work or are no longer working. Optune is not for everyone. Talk to your doctor if you have an implanted medical device such as a programmable shunt, skull defect, missing bone with no replacement, or bullet fragment in your head. Talk to your doctor if you have a sensitivity to conductive hydrogels, like the gel on electrocardiogram stickers. Do not use Optune if you are pregnant or planning to become pregnant. The most common Optune-related side effect was a skin irritation beneath the device transducer arrays. Most patients reported mild to moderate skin irritation. This is not a full list of risks and side effects. Talk to your healthcare provider and read the Optune instructions for use for more information. Please stay tuned for the full important safety information at the end of this segment.
We were delighted to find out that there was another treatment for glioblastoma. The first doctor that told us about Optune was Janine's neurosurgeon. She was so positive and we trusted her. She was highly skilled.
During my maintenance chemotherapy, I was able to add Optune. It was a relief to know that there were additional treatments available, and I was all in for Optune when I learned more about how it worked.
In a large clinical study of people with newly diagnosed GBM, nearly half of people using Optune plus chemotherapy were alive at 2 years, compared with 31% of people on chemotherapy alone.
The recommended usage rate is 18 hours a day, which is about 75% of the time. And I drive with Optune, also to go to the grocery store, to go to the movies with my nieces and nephews. One thing about Optune is that it cannot get wet. And if my family is planning any activities or vacations around water, I just remove the Optune and take a small break from it. And as long as I'm hitting that 75% usage rate, I'm okay. And it took my family a little time to kind of adjust to helping me, but everybody kind of after a few weeks got the hang of it.
Well, when I found out I would be the one that would be shaving her head and applying these arrays, I was a bundle of nerves. But we all learned very quickly, and in a couple of weeks, it became very easy to me. If you're a caregiver taking care of a loved one with cancer, I do encourage you to take time for yourself, to get the support that you need, because by caring for yourself, you'll be able to care for your loved one in a more effective way.
Patients should definitely feel empowered to educate themselves about their disease. So I really encourage people when they're discussing tumor treating fields or learning about tumor treating fields to really speak to their personal providers about this treatment option and see if this is the right thing for them to do.
I've been told that there's no cure for glioblastoma. I have really appreciated Optune. I do encourage GBM patients to listen to their bodies and have open and honest communication with their oncologists about anything they're experiencing.
I've learned that life can change on a dime, that one day it can be sunny and the next day you're facing the greatest storm of your life. I've learned how really strong Janine is. To see her have the courage and the bravery, and even in the greatest suffering, I've just learned her true character, which I am amazed and honored to be her mother.
What an empowering story. Oh, Montel, goodness. You can learn more about Optune at optune.com or go to our website, thebalancingact.com.
Important safety information and full prescribing information are available at optune.com.
Stay tuned for full important safety information. Schizophrenia affects 2.4 million people in the United States. People with schizophrenia may seem like they have lost touch with reality, which causes significant distress for the individual, their family members, and even friends. The Balancing Act met with 2 key physicians in the field of psychiatry, along with a patient, to help us understand this complicated mental illness. We start with Dr. Greg Mattingly, who specializes in adult and adolescent psychiatry.
Schizophrenia is a complex, misunderstood, and highly stigmatized condition. The physical causes are unknown. However, it is thought to be an excess or deficiency of neurotransmitters in the brain, including dopamine, serotonin, and glutamate. Contrary to portrayals of the illness in the media, schizophrenia does not involve a split personality. Rather, it is a chronic mental health disorder that disrupts the patient's thoughts and perceptions of their surroundings. The illness commonly interferes with a patient's ability to participate in social events and to foster meaningful relationships. Caregivers play a critical role in the lives of people with schizophrenia. They help them with day-to-day living, social emotional support, and often are involved with their medical care.
I started hearing voices. Mostly it was voices that tell me to hurt myself, but then also I had feelings of paranoia, like I felt like people was out to get me, and sometimes make you want to isolate. And once I started hanging to myself, I knew something was wrong. My oldest daughter was kind of helping me. Go into the hospital and check myself in.
Dr. Vadim Baram has over 15 years of experience in treating patients with a variety of psychiatric problems in both outpatient and inpatient settings. Edgar Thomas has been his patient for many years.
A diagnosis of schizophrenia often follows the first manifestation of mental illness, when an individual first displays symptoms of schizophrenia. For diagnosis, a patient must exhibit 2 or more symptoms, each lasting for a significant portion of at least a 1-month period. These symptoms could include delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. At least one of the qualifying symptoms must be delusions, hallucinations, or disorganized speech. Negative symptoms can include apathy, lack of emotion, and difficulty concentrating. Scales measuring positive and negative symptoms in schizophrenia and track treatment response in schizophrenics remain the primary mode of assessing and diagnosing schizophrenia by clinicians and researchers.
When I went to the hospital, I met Dr. Baram. After I explained the symptoms that I had, he diagnosed me with schizophrenia. He seemed like he was concerned. He kind of worked with each issue as an issue by itself.
In addition to a psychiatrist, behavioral therapy, and psychiatric therapy, medication is used. Many treatment options are available for schizophrenia, and finding the right treatment that works for each individual is important. There's a stigma associated with schizophrenia, but it's important to seek out advice from a medical professional. Gather information about your disease, discuss your symptoms to find the appropriate treatment to manage your disease.
Intracellular Therapies, a leading biotech company, was founded on Paul Greengard's Nobel Prize-winning research that uncovered how therapies affect the inner working of cells in the body. Their mission is to develop treatments to improve the lives of individuals suffering from neuropsychiatric and neurological disorders.
One treatment I'm happy to discuss today is Caplyta, which the FDA approved in 2019 as a treatment that effectively treats schizophrenia in adults. This medication is a once-a-day pill, where the starting dose is the effective dose, so you're on the right dose from the start. In 2 clinical trials, Caplyta was proven to help control symptoms of schizophrenia. In both clinical trials, Caplyta was significantly better than a sugar pill or placebo at managing schizophrenia symptoms. Patients taking this medication also showed an improvement in the overall severity of their condition, which was measured by a schizophrenia rating scale. It's important for patients and caregivers to know that Caplyta is not for everyone. Elderly dementia patients, for example, have an increased risk of death or stroke. Serious side effects can occur, including a life-threatening reaction that can cause fever, stiff muscles, or confusion. Now, it's important to know that Caplyta, like other drugs used to treat schizophrenia, may cause problems with your metabolism, including high blood sugar, diabetes, increased fat, cholesterol, and triglyceride levels in your blood and weight gain. However, in short-term trials, patients taking Caplyta had weight, cholesterol, and blood sugar changes similar to a sugar pill. You should know that each drug has its own specific risk profile. In a long-term study of Caplyta for 1 year, patients had, on average, weight loss of 7 pounds, which I find favorable for this patient population.
Your doctor should check your blood sugar, fat levels, and weight before you start and during treatment with Caplyta. Extremely high blood sugar levels can lead to coma or death. You should tell your doctor if you have any symptoms of high blood sugar, such as weakness, increased thirst, and urination. Like other schizophrenia drugs, Caplyta may cause bodily movements that you cannot control. This can be a sign of tardive dyskinesia, which may not go away even if you stop taking Caplyta and may start after you stop taking Caplyta. In a 4 to 6 week study of Caplyta, movement disorders were uncommon and similar to sugar pill. Caplyta can also cause dizziness upon standing, falls, and impaired judgment may occur. Patients should be aware that the most common side effects they may experience with Caplyta are sleepiness and dry mouth. Sleepiness with Caplyta was predominantly mild.
There are a lot of schizophrenia medications. If you or a loved one are looking for a schizophrenia treatment, you should have a conversation with your doctor about your symptoms so they can find the best treatment.
Schizophrenia is complicated, and so is treating it. We understand that starting a new treatment can feel overwhelming, but your doctor and healthcare team will help you every step of the way.
Take the Caplyta. Some of the things I can see in progress is, when I talk to people now, I don't have to focus on the voices. I can focus on the communication that I'm having with the people that I'm with. I can cook for myself. I can clean for myself. I used to be a real avid piano player, and I'm just getting back into it. Take the Caplyta. It's the only thing that worked for me. That's why I'm sticking to it.
If you're affected by schizophrenia, have a conversation with your doctor about Caplyta today. Please listen to the important safety information, including information about the boxed warning at the end of this video. Important safety information and the full prescribing information is available at Caplyta.com. You can also visit our website, thebalancingact.com. For over 200 years, Arnica montana, a type of mountain daisy, has been used as a natural pain reliever and as one of the most popular homeopathic medicines in the world. Today, many are looking for safer solutions when it comes to pain management. After all, 125 million Americans suffer from pain. Joining us virtually from New York with some insight and solutions is Dr. Ken Redcross, board certified in internal medicine, who takes an integrative, holistic approach to wellness. Doctor, why are we, especially women, turning more towards natural solution when it comes to everyday minor health conditions?
About 80% of my practice are actually women. Not only that, women are the decision makers, and what we're starting to see as far as the new trend is that they want something that's topical for a pain reliever, not something that you have to worry about drug interactions or you have to worry about side effects. No, something that's a little bit closer to the earth, as I say.
What is Arnica and how does it work?
Arnica works with the body. It doesn't mask symptoms like some of the other things that are over the counter. It's odorless. It's a really big deal for a lot of my patients. You know, a lot of my other female patients love the fact not only does it help for pain and swelling, but it helps for bruising. So who wants to have that bruising when you're wearing a nice summer dress or something along those lines? And so that's a nice little plus as well.
Doctor, thank you so much for your time. You're such a pleasure.
Oh, thank you, Olga. I can't wait. Stay well, everybody.
You too. God bless you. By the way, this can be found online at arnacare.com, amazon.com, and your favorite retailers, pharmacies across the country. Remember, you can also go to our website, thebalancingact.com.
Thanks so much for joining us today.
Remember, head to our Facebook page, our website, and you can also follow us on Twitter.
That's right. Please stay safe. Take care of your family. We'll see you next time.